Hello, my name is Alexander Rivkin, and today we'll be demonstrating the non-surgical rhinoplasty procedure on a patient in my clinic in Los Angeles. Non-surgical rhinoplasty is a procedure that I've been performing daily for 15 years now. It's a procedure that patients love because it's safe, effective, and virtually painless. If performed by an experienced injector who thoroughly understands the technique and the anatomy, this procedure can effect a dramatic change to the contour of the nose in 10 minutes without downtime, without pain, and with minimal risk. In my experience, ethnic patients in particular desire improvement to the aesthetics of their nose without a change in the fundamental character of their nose appearance. They do not want to be perceived as if they're trying to erase their ethnicity. The precision of this procedure presents a particular advantage over surgery for the right candidate in achieving the goal of aesthetic improvement without changing the ethnic character of the nose. Patients undergoing non-surgical rhinoplasty are able to indicate and receive very specific contour adjustments and exclude any other change to their nose. When performed in the manner illustrated, the only anesthesia necessary for this procedure is some 23% lidocaine, 7% tetracaine numbing cream for 15 minutes prior to injection and some distraction tapping during injection. We use chlorhexidine and alcohol for antisepsis. In this procedure, I'm using Voluma. I prefer this filler because it lasts longer than anything else on the market right now except Belafil. As can be seen, I'm delivering the filler via 0.3 cc BD syringe. The advantage to injecting through this syringe is that the needle is 31 gauge. A smaller needle is less painful and it's easier to deliver less product in a more precise manner, a big advantage for the nose where every drop of volume makes a large difference in contour. So here's how the product is transferred from the 1 cc Voluma syringe to the BD syringe. Needless to say, this should all be done in a sterile manner. The plunger is removed and the Voluma is backfilled using a 21 gauge needle on the syringe. A maximum of 0.2 cc's is transferred and the plunger is carefully replaced. It's important not to overfill the BD syringe, but if less volume is required, less can be transferred. And we're ready to go. This patient has the dorsal bump and tip droop that I commonly see in my Latino non-surgical rhinoplasty patients. She desired a straighter nose on the profile. To camouflage the bump and straighten the nose, filler should be injected here and here. It's important to refrain from over-injecting the tip and widening it from the frontal view. I like to do all of my injections with the patient sitting at close to a 90-degree angle. Sitting or standing is how others perceive you most often, so in the interest of precision, I want to see the effect of my injections as others would perceive them. I'm injecting the filler mostly at the periosteal or perichondrial level, but when I want to get extra lift, I'll trail the injection out as I withdraw the needle, leaving a column of filler that fills up all of the planes of tissue. In consideration of safety, I make sure to go slowly, to inject softly, without too much pressure, and to always have the needle in motion when I'm injecting. I think that these are more reliable safety measures than pulling back on the plunger because there's a high probability that your needle has moved between the motion to pull back and the motion to push forward. If you notice, the thumb and index finger of my left hand are making sure that I'm not making the radix more broad with my injections. I'm molding and smoothing the filler into the place I want it to occupy after injection. Most of the fillers available today are easily moldable. Here, I'm blending the bump into the radix with tiny injections. Smooth transitions are the key to camouflage and making the nose as straight as possible. Each injection is around 0.01 to 0.02 cc's of filler. I've used about 0.12 cc of Voluma for the radix area. I now shift my attention to the tip and tell the patient to ice the area. Prior to injecting the radix, I was having her ice that area as well. Icing helps with pain, and I think it vasoconstricts, decreasing the risk of bruising. The radix is much less sensitive than the tip, so you will see her flinch a bit when I inject here, even with a needle this small. Similar to the radix, I'm injecting here mostly supraperichondrially. I'm trying to get more height to the tip by lifting the skin above the lower lateral cartilage domes. Here the tip is lifted, but the supratip area still needs to come up to form a straight line. Here's the completed procedure. Her nose is still recognizably her own, but much straighter. Its ethnic character is unchanged. I hope this has been helpful.